sorry. Your hair rubbing against the mic.
Right.
Oh.
So a lot of
Oh, okay.
Okay, no problem.
Okay. Okay. Sorry, 3, 2.
Hello, welcome everyone. I'm Khay Mun, your host for today. For today's podcast, Halley's Beauty Talk, where we talk about everything that's got to do with beauty and aesthetics. For today, we have Dr. Terence Tan from Halley Body Slimming Clinic and Kerlyn, who's the operations manager for the clinic as well, to talk about a hot topic on fat reduction. And maybe, Kerlyn, would you like to introduce yourself?
Hi, I'm Kerlyn. I'm the operation manager at Halley Body Slimming Clinic. Today we are here to talk about the question we received about fat loss and body contouring.
Yeah, I think we get a lot of questions in the clinic about body sculpting, which is fat loss versus weight management. So,
I find that a lot of times people are confused between weight loss medication and fat reduction with CoolSculpting. So we have Dr. Terence here to actually help us explain about the misconception people have.
Okay, so actually fat loss and CoolSculpting is the same thing. So it's this big category called body contouring, whereby we use various devices, and in the case of CoolSculpting, it's a non-invasive fat freezing device to cool down fat cells to kill it. And then through a process called apoptosis, the body reabsorbs the fat and reduces really the number of fat cells in that specific area. So where you treat, you have a good result, but where you don't treat, probably nothing will be seen. In this way, you are actually contouring the body, and as the name CoolSculpting implies, you actually sculpt the body to a shape that you want. So it's a fat cell reduction technique. Whereas this contrasts to weight loss. So there are some people who have a BMI, say, above 30 or even higher, or above 27 with some chronic illnesses. They would benefit from significant weight loss. And of course, significant weight loss can be done with a lot of elbow grease and hard work through lifestyle changes. But a lot of times, there is a limitation because it's largely genetic in nature, and they need some help from the doctor. And in appropriate cases, giving medications or even having adjuncts like dietary advice, seeing a dietitian, a nutritionist, would lead to weight loss. Now, weight loss is different from body contouring in that the number of fat cells remain exactly the same. The only difference is that when we have weight loss, we actually use up more calories than we take in, and as a result, fat gets taken away from these fat cells to power the body, leading to a general reduction in the size of our fat cells, and therefore we have got generally a lower weight. And this is really very important for people who have excess weight, because it can lead to many chronic illnesses like heart disease, stroke, certain cancer which are related to lifestyle. Having this distinction is very important. Then you can pick and choose what treatments to do for the appropriate patient.
I see. So do you have a lot of people coming into the clinic and thinking that if I want to lose weight, I should be doing CoolSculpting or even,
So it's like a lot of people have the misconcept that since that's the case, do I still need to do like weight loss since CoolSculpting can help me take away my fat cells?
Well, yes and no. I feel that these two treatments are actually complementary. Although CoolSculpting is really just to sculpt the body, it doesn't really change the weight too much. But at the same time, when people are motivated, the mind is really a powerful thing. So we find that although CoolSculpting doesn't reduce the weight to a significant extent, it only helps, or rather it helps sculpt the body to a shape that you want. So it's good for people with stubborn fat. We also found that because of this, because of the commitment to the treatment, they also adopt a healthier lifestyle, and they also have some weight loss. But of course, I think more importantly, people who need significant weight loss and who need help because they can't do it by themselves through healthy lifestyle, or are too busy to make enough lifestyle changes for significant weight loss, then I think we should help with weight management, and in this case, with medications. Now, I think lately there's been a lot of buzz with regards to a new form of weight loss medications. I think a lot of us have actually encountered it in the media. This is really called the GLP-1 analogs. Okay?
Yeah, we did receive a lot of inquiries even before I think the medicine is even in the market or approved. Yeah, so a lot of people call in to ask whether you have this medicine, whether it's available. So maybe you can explain more about what is this medicine so that everybody knows.
Okay, so this class of medication is actually not new. So they've been around for a long time. It mimics a hormone that we have in our body called GLP-1. And these hormones are called incretins. So incretins are what's produced by our gut and our stomach when we eat in order to handle the food that comes in. So primarily what it does is it causes our pancreas to produce more or secrete more insulin, therefore transporting the glucose and storing the glucose into our muscles and into our liver when we consume food. But this is a bit abnormal or not functioning as well in diabetics, and this medicine has been used in diabetics for a long time. So this medicine is not an incretin per se, but it mimics an incretin and lasts a long time, and therefore it's useful as a medication. But along the way, people have found out that actually it has other actions as well. And it makes sense. Incretins actually help handle food, and to handle food, you need to make the mind feel full. At the same time, it also stops the food from going down the stomach so fast, aiding in mechanical digestion and breaking down of these food particles. And these new class of medications actually more effective than previous class of medications, and most doctors, although not all, will also think that it is actually generally safer than what we have currently in the market. So there are various types of GLP-1 analogs. So we have got liraglutide, we've got semaglutide, and semaglutide is probably the one of interest right now, which most people are most interested in. And studies have shown that for semaglutide, after 1 year, the studies have shown that most people lose about 18% of their body weight.
That's quite a lot.
That's quite a lot. I mean, but some people think it's very little, some people think it's a lot. But with even 5% weight loss, you start to have health benefits. And at 18%, a lot of people, especially who are very overweight, do experience a lot of health benefits in terms of their knees, in terms of their kidneys, in terms of their heart, in terms of their brain, and generally in terms of their general well-being. And this is even more remarkable in that a third of these patients actually lose more than 20% of their body weight based on studies. So that's one innovation. And further medication and a further innovation on this GLP-1 analogs is a new medication called tirzepatide. And tirzepatide is actually analog of two different incretins, GLP-1 and GIP. So a lot of doctors think that by having a dual mechanism of action, both targeting incretins, but in a slightly different way, you have a more effective treatment with less side effects. But the verdict is still out there. It seems that early study shows that it is makes people lose more weight than GLP-1 analog. So for the people who actually need it, these medications are really very effective and very safe, and leads to a lot of health benefits, either then or later on in life. So therefore, I think it's still important for us to look at weight on top of just really CoolSculpting. But having said that, I think these two treatments go hand in hand because generally people who have stubborn bulges and need some form of body contouring like CoolSculpting will also benefit from the weight loss, and also vice versa.
I see. Maybe to backtrack a bit, I think you mentioned that the current weight loss medication that is GLP-1 based is semaglutide. So, but you're saying that previously there was something else. What's the difference?
Yes, I think these are called GLP-1 analogs. So, for all intents and practical purposes, the body cannot tell the difference between liraglutide, semaglutide, or nascent GLP-1, which is the GLP-1 we have in our body. However, how long it lasts is different. So GLP-1 lasts only for a few minutes, so it needs to be constantly secreted or constantly produced by our gut after eating. Whereas liraglutide lasts for a day, and therefore it can be injected once a day. So did I forget to tell you that they are injectables?
Yeah. You mean there are also oral, but
Yes.
there's also oral ones.
Exactly.
Yeah.
So semaglutide is a further change in the molecule such that it lasts for about a week or so. In fact, a little bit longer. GLP-1 is available both in terms of injectable and in terms of an oral medication. It comes in various names, which I will not say right now, but different names actually denote the same medication, either for different indications. So one's more for indicated for diabetes, one's for weight loss, and one's an oral form.
I see.
Yeah, but for all, amongst the different brands, they are actually semaglutide, which
I
is
see.
the same medication.
Maybe I throw the question up to both of you. Are people afraid of doing injection? Because I mean, injection needles.
Well, we do have people who are fear of injectables. So whenever we say, oh, we have injectables, they start to back off. Oh, injectable sounds scary. Actually, it's not really that scary. The needles are really very short, very fine, and we'll walk through the injection technique during the consultation as well. So it's very safe and very easy to use. And I think the latest one, like Dr. Terence said, it's only once a week. We have the latest one is once a week only. So you only need to inject once a week. So easy. I think it's really a great news for all the people who really need it. Yeah.
I mean, nevertheless, I think there will be people who do truly need the medication and do not want any injectables under any circumstances, be it some form of belief or the fear of needles. There is an oral form of semaglutide that's effective for weight loss, but actually branded for diabetes. But since the medication is exactly the same, a lot of doctors use it on an off-label basis in order to achieve weight loss, either in people who have diabetes or people who don't have diabetes would benefit from weight loss.
Okay, so I think I want to go back to something that you said earlier on about elbow grease and all that. So do you have a lot of patients or people come in who think that, hey, since I can do this weight loss injection technique, that means I can totally, eat whatever I like, I don't need to exercise?
Yes, we definitely have a lot of people who has this misconception because they comes to clinic because they want to do a shortcut, so they don't have to exercise. So they thought that after with the medicine they don't need to eat. I mean, they can eat whatever they want because with the medicine will help them on losing weight. But actually, I don't really think that really works that way. Since the medicine is helping you, why don't you move a step forward and then you control what you eat to have a even better result? I think Dr. Tan can explain more on that.
Okay.
Yeah.
Okay. I can. Yeah. Okay. So of course I can. So yes, I think it's true. There's a common saying that you don't need to be hungry to eat, right? You can eat for a variety of reasons, socially. Some kind of a mental trigger. If we go to the cinema, we need a popcorn. Otherwise, the experience will not be complete. And if you go to a bar and we have a little bit of alcohol, we have to eat peanuts or some form of snacks. So I think these are all social circumstances. Yeah. So I think it's also very important for us to have a good mental attitude as to how we want to have sustainable weight loss. And sustainable is the key, because the medication helps you when you are using it, but when you're not using it, your appetite goes back to normal, the way your gut handles food goes back to normal. And therefore, there must be certain lifestyle changes to keep the weight off, because once you lose weight, you have less caloric requirements. Your basal metabolic rate count goes down. Even doing certain activities reduces there's less calories needed to do exercise or certain activities. So you do need to do certain things to sustain the weight loss. And studies have shown that while dieting is probably the most important for weight loss, exercise is probably more important to sustain the weight loss, because it's discretionary. If you are hungry, you have to eat, but you can always choose to exercise or not.
I see. So does that mean that you have to continue taking this medication, or?
So that depends. A lot of experts feel that obesity or being overweight is a genetic condition. Okay, so people have heart attack because they have certain genes, and people are overweight because they have certain genes, and the body wants to keep at this weight, and therefore, if we will find that we lose a bit of weight, the body wants to eat more, the hunger response becomes even more than what it was previously, and metabolic changes might occur, bringing you back to that weight. So therefore, for these people who really need it, who have very high body weight and high BMI, they might be reliant on this medication for the long term and maybe even a lifetime. But there are people who manage to do certain lifestyle changes, and that's arguable. Some people feel that that's unlikely, but I feel that based on my experience, it's possible, and it's actually quite common. And they do lose their weight and maintain their weight loss for quite some time. So typically people will come and we'll give them this medication. Sometimes we will stop, either because they can stop or they choose to stop. And in general, maybe about 30 or 40% will rebound. Maybe about 30 or 40% will keep their weight. And maybe about 20% will actually rebound a little bit, but still maintain a weight which was significantly below what it was when they started.
Okay. Right. Maybe I ask Kerlyn. I mean, you probably get a lot of calls from patients as well. When people call, are there certain areas on their body that they are particularly concerned about?
Yes. Yeah. I think all over the body.
All over the body.
Okay, there are some people who are concerned about like double chin,
okay.
or like female common areas like abdomen, arms. I think men also have, but men common area are usually the abdomen. Yeah, because men usually their lower legs usually are okay, but women are usually all over the area, to be honest. Yeah. Okay. So we do have a lot of people who call in to inquire about CoolSculpting. Yeah. So they are inquiring about different areas. So we will advise them, you come down and have a proper consultation with the doctor for a body assessment, and of course the doctor will assess and see whether they are a suitable candidate for CoolSculpting. Okay. Yeah.
So can weight loss medication remove a particular area of fat on my body?
Maybe
doctor will answer,
or professional.
Yeah.
Yes. Okay, so anyway, I'm sure Kerlyn can explain better.
Yeah, but I think since I have my professional doctor here, the doctor explains better.
Yes, but in a general kind of way, if you do lose weight, there'll be mild reduction in waist circumference, in arm circumference, in thigh circumference, but this is probably not going to be as effective or as significant as doing body contouring. So I think body contouring is actually very, very important in our practice because it does something that weight loss cannot do. So body contouring sculpts the body, makes stubborn bulges go away, and it goes away for the long term. Why do I say for long term? Because studies have shown that only children can make new fat cells. Adults lose this potential. So as when you reach 16 to 18 to 20, you stop growing taller. So at the same time, the body doesn't need to make new fat cells. I mean, it just needs to maintain the fat cells, and the body loses its ability to do various things in terms of reproduction. So in this case, we can't reproduce fat cells. Fat cells stay the same. So this is good because when we do body contouring, whatever fat cells that we kill is gone for the long term, leading to sustainable changes in our body shape. So whereas weight loss would go up and down depending on your weight, because we know that fat cells will get bigger and smaller.
I see.
And the other thing about body contouring that does something that weight loss or weight management cannot do is that you can't change the body shape. So for example, if I look like a pear, I want to look like an apple, then weight loss will make you a smaller pear.
I don't want to look like an apple actually.
Let's say you look like an apple, you look like a pear. You will just become a small apple and not a pear, and vice versa for men. Right? So body contouring is very important. So there are various ways to body contour, but I think CoolSculpting or fat freezing or cryolipolysis is a good way.
I see.
So the machine looks a little bit like a unit with a ice cream scoop, I've been told, which is attached by a hose to the main unit, and the main unit is a cooler. The hose transfers the coolant, or rather the cooling treatment to the applicators. The applicators are placed on the body, sucks in the fat and the skin, and it freezes in a very specific and a very sensitive way over a period between 35 minutes to an hour plus. And during this time, the fat cells get reduced to between -9 to -11 degrees Celsius. And at this very, very specific temperature, studies have found that this is effective in killing off fat cells, which are more sensitive to cold, whereas other cells like the overlying skin, the nerves, the muscles are generally not affected for the long term.
I see.
So this is called selective cryolipolysis or selective lipolysis, such that you selectively, break down fat and not the other tissues.
Okay.
Okay, I think to add on, I think we do have people who also think that this misconcept that you say that CoolSculpting is very targeted, right? So weight loss cannot actually give you the apple become pear or pear become apple. Okay, so people thought that not by doing exercise like on targeted area can actually help them shape their body. Is it true?
It's true only for muscle, but not for fat. So there's no evidence that there's spot reduction of fat. So what happens when we exercise is that we actually use up energy and we have a calorie deficit. In other words, we use up more energy than we take in, and therefore we lose fat from our fat cells and we lose weight. But doing sit-ups will not reduce the fat cells in your tummy, and doing squats will not reduce the fat on your thighs. And that requires certain, destructive methods like CoolSculpting to get the job done.
So it means that all the sit-ups I've been doing just to try to remove my abdomen fat's all wasted.
It's not wasted because it's definitely not wasted because I think muscle is actually a very important component to keep what we call visceral fat, which is fat within the tummy, sucked in, and that's definitely not wasted. Healthy lifestyle is never wasted.
I see. So you mean to say that, okay, so if I want to remove the fat on my abdomen, no matter how much sit-ups I do, it will not remove the fat. It will certainly build up the muscles in those areas. I see. So like even lifting weights will not help me get rid of my bye-byes.
No.
Whereas, body contouring using CoolSculpting can help me with that.
Yes.
Yeah, okay. So on this topic about body contouring and all that, is this something that a doctor should be doing or a therapist can do? Because I see fat there, I just put on what you say like an ice cream scoop, right? So what?
I need to say something because I'm very passionate about this.
Yeah.
So I think, remember I said that it's a very powerful equipment. So I think with great power comes great responsibility.
I think Spider-Man said that.
Therefore, I think CoolSculpting should have deep involvement of the doctor. Yeah, because I think it sounds a little bit easier than it actually is. So firstly, I think the doctor, being a doctor, has got a better understanding of how the body functions and what will lead to better results. And more importantly, the doctor also assess to see what can go wrong. I think in life, we want to make sure that nothing goes wrong before we think about what can go right. So the doctor will find out whether you have any medical conditions, like certain conditions which are sensitive to cold involving the blood, should not have CoolSculpting done. And for other people, like maybe people with cold urticaria, whereby they have got rashes when exposed to the cold, perhaps certain medications could be taken before CoolSculpting in order to get the job done without any complications. And number two, I think the doctor has got a better idea as to what might lead to a more efficacious and a more effective result. Nevertheless, no matter how experienced the therapist is, I think CoolSculpting is still a team effort. So 2 eyes is better than none, but 4 eyes is better than 2, and 6 eyes is better than 4. Okay, so when the doctor does the plan, that's precisely the most important part about the treatment, because after that, because the machine is so high-tech, you really don't have to change many settings, and it's just about putting the applicator on the right place. So the doctor's involvement is really in planning, and that's really the value add. The doctor will assess the fatty bulge and use a whiteboard marker to draw. And of course, when I said 4 eyes, then the assistant would then give an idea and a second opinion as to whether he or she agrees that that's the case. And where's the six eyes?
Yeah, where?
The patient's own view is also very
okay.
important because
That's true.
the patient is not sick. There's no fixed way of doing things. I think the patient's opinion as to what he or she wants is also very important. So 6 eyes are better than 2.
I see. So, I mean, is that the reason why CoolSculpting, the prices of CoolSculpting is very different in the market? There are those that are very cheap, and then those where some people feel are expensive.
Well, we can't control the market price, yeah, but what we can say is what machine we're using, the authentic machine, and then we have a team of staff that is all well trained with doctor that assess the body and do a proper drawing, because I think every people, their shape are different, so how you draw makes really a big difference. Yeah, so by drawing the exact fat bulges area that you want to target, placing at the right area give actually the maximum result. That's why doctor involvement is very important.
So you're saying that perhaps the cheaper priced clinics may not have a doctor's involvement?
Perhaps, we are not
okay.
sure, perhaps because we can't really check and we don't know, but what we can say is what we have. There is, people will say that some places are done by not doctor, but we wouldn't know unless we really go and do the treatment over there.
Okay,
Yeah.
so but what I gather is that doctor's involvement is very important.
Yes.
Because it is, after all, a doctor would need to know what, if there's anything that the patient is...
Yes,
yeah,
you come to a clinic because there's a doctor, so the doctor is there to care for you. So if there's anything or any question, you are always there to ask the doctor. Yeah.
So I think the audience might not know, but in a certain country, the health authorities have approved this machine to be used in clinics only. And that's very, very important because studies have shown that results are better when done as a team and will lead to better patient satisfaction.
Okay. You mean the US FDA, right?
Yeah.
Yeah. Okay, so doctor, just now you mentioned about whiteboard markers and drawing. Maybe you can explain to us what you're talking about.
Okay, yes.
Yeah.
Actually, I would love to. And I've actually prepared our lovely iPad and our lovely model. Okay, over here. And just to tell you that not everybody is the same. In fact, all of us are different, especially male versus female. Even within a female tummy, which we do see more often, as you would expect, there are different shapes. So for example, for this tummy you see over here, it's generally a very wide and diffuse distribution of fat. So you can sort of make out where the fat is, but you can't really see where exactly the fat starts and where the fat ends. So this is one kind of tummy. So the other kind of tummy will be tummies in which they are a little bit more localized, just near the umbilical area or the belly button, and these look a little bit more, like a diamond shape. So this lady had a little bit more of a Christmas tree shape. In fact, you can't really see the Christmas tree because it's got a diffuse distribution of fat. And what do? We would draw the applicators with whiteboard markers. So we have a template. These templates are 3D. They mimic how applicator looks like in terms of shape, and we place it over the fatty bulge, and we are probably going to have one large applicator below like this for the bottom in this case, and then maybe 2 more over here with a little bit of overlap, and these might be a little bit smaller. Okay, so it's called the C150 applicator and the C240.
Actually, doctor, maybe before you go on, maybe can you explain what is an applicator?
An applicator is really the part of the machine that actually sucks in the fat and the skin and does the physical cooling. And within the applicator, there's also very sensitive sensors to make sure that the temperature is within what we have talked about, -9 to -11 degrees. And these applicators are placed on the tummy over a period of time. So for us to make sure that we have accurate placement, we do have to draw with the templates where we have to put the applicators. So that's really the most important part of the treatment process, which is not treatment itself, but the planning and the preparation.
Okay. I mean, it's good that you showed me this because, I mean, just looking at this picture, all I can see is this fat bulge at the bottom. I don't really see that, okay, the the person need 2 more over here. So it's
You're right.
yeah.
Actually, most of the time when we actually do the drawing, right, the patient is only abdomen, but they wouldn't know that, actually they have other areas whereby it can actually improve the overall shape.
see.
So during the assessment and drawing, the doctor will actually draw the whole area, and then the patient will see, oh, this is how it is done, and then after the treatment, what kind of shape would I be expecting? Yeah. So actually, it is really good with a proper good drawing.
Yes, very important. So the first 2 eyes are very important. First 2 eyes, the doctor's eyes, make sure that there's appropriate placement applicator. How do we know whether there's fat when the fat looks a bit diffuse and can't be seen well? Well, we actually do pinch. When we pinch, the skin and the fat goes into the pinch, whereas the muscle and the other tissues are left behind. So you can actually approximate how much fat there is in a certain area. So for example, let's say this person, this same person has a less diffuse pattern, and it's a very localized pattern. Not in this case, but just imagine that this person has a diamond-shaped kind of fat pattern. Then we are likely to put 4 smaller applicators with crisscross a little bit like this in order to get the job done, because you only have it in the center and not so much on the sides.
Yeah,
So you
meaning
want
those
applicators
people
like this.
that are more in the center.
I see.
Yeah,
Oh,
so
okay.
it will be all localized on the center.
Okay.
Yeah, so it's really very different patterns. Yeah,
I
depending on
see.
shape.
I can imagine. I think if I'm a therapist who's not trained to look at the body shape and where the fat is placed, I wouldn't know. I mean, is that also one of the reasons why some places have got cheaper treatments, because they may think that only 1 applicator is needed
Yes,
rather than
could be.
4.
Could be, yes.
And it's also important for us to customize for not just the fat distribution, but also the desired body shape. So for example, between men and women, they are slightly different. For men, we like to reduce this area of fat, a little bit lower down to get a V-shaped body. Whereas for women, we generally want to reduce the waist a little bit higher up here, in order to get a more of an hourglass shaped body.
Yeah, I mean, you wouldn't want to have a straight waist, right?
No, not certainly not. Yeah.
Yeah, and so having a second opinion
see.
by the therapist who has probably maybe better aesthetic sense, maybe not, than the doctor, will also lead to a good outcome. And finally, we don't need to treat whatever you are not concerned about, because you're good the way you are, but we can improve you if you have some concern.
Okay. So, I mean, I get it. I mean, sometimes you go in and then because you're drawn in by the price, and then, after consultation with the therapist or with the doctor at the clinic, you realize that, hey, actually it's more than just one area, and I end up actually paying a lot more than what has been advertised. So, other than CoolSculpting, there may be also similar fat freezing devices in the market.
There are many fat freezing devices in the market.
Is that the reason why, sometimes the prices differ?
Yes. So that's why it's always very important to check what machine the person are using, what machine they are selling, and the price, so that you get the authentic fat freezing machine. Yeah.
Okay, and
Yeah,
it's
I
important
think
for it to be authentic, is it?
Yes, because I think safety is paramount. As we said earlier on, with great power comes great responsibility. And if you can't take the responsibility, chances are the power is not good enough. Okay, so let's say if you go on to a fat freezing device found in a salon or a spa, doctor's not there. If something goes wrong, it's probably a little bit difficult to handle. So chances are it's not quite as powerful as the ones that you find in the clinic through CoolSculpting. And CoolSculpting is the only cryolipolysis or fat freezing treatment method approved by many health authorities.
Okay, and I suppose the fact that it's approved by health authorities means that it is safe, effective. Yeah. So,
the machine have a lot of safety features.
I see.
So it can detect that your body goes down to a certain temperature, is unsafe to continue, it will just stop. So it has a lot of safety features that maybe some other fat freezing machine doesn't have it.
Okay.
So you'll be sure that you are in safe hands, because you have a doctor there with you, and then you have the authentic machine that has very safe features inside.
Okay. All right. So, doctor, you talked about what can go wrong. So maybe you can we find out more about what exactly can go wrong during CoolSculpting?
Well, as with everything, with great power comes great responsibility. Yeah. So if something is really, really powerful, you need to make sure that you're responsible for it, and you also have to make sure that it's well controlled. So as you said, if the temperature goes below -11, you can get cold burns over the skin, and that can lead to disastrous consequences. And of course, if you don't want to take this responsibility, if the doctor's not around, if you're afraid to cause problems, for example, the cryolipolysis machines in a spa whereby the doctor's not present, then chances are the power's tuned down a little bit to make sure that it's done safely. However, below -9 degrees, you will not get any lipolysis. So therefore, the key is that you have selective lipolysis, whereby you have lipolysis, which is the breakdown of fat, but at the same time having the skin and the other tissues not affected for the long term.
I see. Okay, so a cheap treatment might end up being expensive because if it's not done correctly, then I need to do more to get the result that I want. So
Or you might not get a result you
At
want
all.
at all if it doesn't reach the correct temperature, or you might get what you don't want if it's too cold.
I see.
To damage your skin. Yeah.
Okay. So, well, it sounds like CoolSculpting is pretty much effective. I mean, it's US FDA approved, which means that it's safe, it's effective, as opposed to other types of fat freezing machine that is not US FDA approved, because that means there is no studies that shows that it is effective. So does that mean that I only need to do CoolSculpting once and then that's it?
Well, we know that the results are long term. So once you've done and you reach where you want to go, I think that's good. You can just leave it aside for a long time. However, one treatment only reduces between maybe 20 to 27% of the fat cell thickness based on most studies as an average. And therefore, if it's not good enough, it's good, but it's not quite good enough, then you have to repeat it maybe about 2 to 3 months later, once or even twice or even 3 times. Yeah.
Okay.
To add on, actually during the assessment and consultation, the doctor assessed the fats where he pinched. So the doctor will let the patient know that roughly how many rounds you need. So they will know in advance what are they expecting. So some whereby the fats are not really that thick, maybe 1 round will be able to satisfy them for the result. But maybe some, they really thick one, they may need 2 rounds or more, the doctor will advise.
I see. Actually, you brought out something that I didn't ask earlier on. So can I do CoolSculpting without weight loss?
Actually, it really depends on how heavy the person is, whether they are really overweight. Some people really come in, they are not overweight, they are just here to sculpt their body. Certain bulges on the abdomen, or maybe what you say, the arms, flabby arms that they don't like. So this kind of people, maybe they can just opt for CoolSculpting because they only need to do body contouring. But for people who are overweight, and we strongly advise them, actually the doctor will advise them to actually combine together to get the best result. Because as he mentioned earlier, CoolSculpting doesn't really reduce your weight. It's more on body contouring, whereby weight loss medication doesn't sculpt your body. So they work hand in hand together. Yeah. Dr. Terence, you want to explain more?
No, actually I think that kind of I really have nothing to add.
Okay. Yeah. So I hear too much from him, that's why I'm always saying the same thing.
Anyway, thank you everyone for your time today. Thank you, Doctor. Thank you, Kerlyn,
Thank you.
for coming to this podcast and explain to us what weight management is about, what fat freezing using CoolSculpting is about. So we now understand that actually they're 2 different things, and it's good to complement them to get the desired result. I'm Khay Mun, and if you like what you have heard today and you would like to hear more insight about beauty and aesthetics, stay tuned to this channel and follow us, subscribe, and if you have any comments, please drop them in the comment box below. Thank you very much, everyone.
Thank you. See
Bye.
you. Bye.